greatest fan site. Greatest fan site. Let me just come from this standpoint again with inordinate and substantial magnanimity in my heart today. I welcome each and every one of us here to the first ever organized indigenous Pharmacosymposium. Our idea was engaged through the national level when we had the Pharmacosymposium, and we the executive, we actively believe that this is an avenue to instill significant courage to pharmacists at large. And in line with the theme of the symposium, adapting to the evolving practice in pharmacy, how are we going to be able to blend, how are we going to be able to attain 360 degrees, how are we going to become a 360 degree student pharmacist, how are we going to be able to be an active thinker. Well, I'm not going to dwell much on the thing as it's taking our time. It's taking me to bring someone who will be able to address the thing very well and enlighten us with what and what to do. So I just want every one of us here today to sit back and relax. The welfare director is going to give the essential justice to that, and we will thank you so much. Thank you for coming. I still remember I always said Lawa Samba Defisoye aka expressed to the West. I hope you all know what West entails. Well, West simply means the W is welfareism and academic. When welfare, we still want to assist from the academic perspective. So the E is entrepreneurship, the S is social and sports, while the T is transformational leadership. That's all we're doing right now. Thank you so much.
We have the person of Mr. Fagbo. And so we'd like to recognize him and look as he steps up to join the high table. Please let's give a round of applause for everyone, Mr. Fagbo, the Department of Pharmaceutical and Medicinal Chemistry.
All the way from Frankai.
I'm telling you.
Frankai has always represented. Appreciate it. Appreciate it. 200 level. You will do something in 300 level chemistry.
You better clap anyway.
Go ahead, it's called Pinako. Emma Cock, Emma Kolo. That's it. Appreciate it.
Round of applause.
That's the man behind it. I appreciate it. Thank you.
And the electrons are the means.
Yeah.
On my phone, they will jump from left to right.
We also appreciate and recognize all the executives. Yes, that have put this together to make sure today is a reality. Appreciate them, please. Appreciate all the executives. Yeah. So while I'm welcoming Mr. Fagbo, another notable personality worthy. Yes. That's all the way from PCL.
I'm telling you.
Clinical pharmacy. That is our own Jim. Our own mama. Dr. Mrs U.I.E EZE. Please leave with it. If there's anything I've learned from this woman, Dr. Mrs. EZE is a very sound moral. I've learned a sound moral from her. Say no, don't cheat in the exam. Don't copy. Have confidence. You know, see, they always boost my morale. Because, and it's true, because in practice, eventually you'll be alone. You'll be alone eventually. You know, when I think about all these things, you see the beauty, you understand? So I say thank you, man, we appreciate it. Thank you, I appreciate Dr. EZE once again.
There's also one thing that I've also learned from Dr. That thing is already, I don't know, it doesn't want to leave me again.
Alright.
You know what the thing is?
What is it?
I'm telling you.
Yes. That's it, Dr. EZE cannot say something without saying
I'm telling you. But that tells you the depth of what she's teaching. She will be teaching you PCL, but she will pause to teach you life.
Yes.
I'm telling you. Please a round of applause as we appreciate her.
So we also recognize our 500 level students for our song going out. Thank you for blessing affiliates, pharmacies. Thank you for blessing the occasion. Yes. Okay. Now the next thing on the agenda is the Dean's speech. So, please let me continue. Appreciate motivator. Thank you so much.
Can I have your seat, please? Thank you very much. I will start from my PSN Chairman, Pharmacist Ayelabola. You are welcome. You know, without him, I won't be registered. I know that. Because if he doesn't forward my name to PCA, I'm in trouble. All HODs present, Dr. Mrs EZE, you are welcome. Mr. Fagbon, Mr. Daudi, and my Excellency, Vice President, I always call him my great fan site. Greatest fan site. Greatest fan site. Well, I want to welcome you to this symposium. It's a great honor to be in your midst today. And the title of your symposium, I was asking the President, His Excellency, to send it to me this morning. Fluid pharmacy, adapting to evolving practice and in a dynamic society. I think I'm correct. Thank you. I think that's the thing. I was wondering, I said, what is fluid pharmacy? I don't know. Fluid pharmacy, what came to my mind? Fluid. You know I'm a pharmaceutical. We deal with fluids. Maybe infusion or something, I don't know. So I believe today I will learn what fluid pharmacy really is. Who is the keynote pharmacy? Oh, this is Dr. EZE. So she will teach me what fluid pharmacy is today because I don't know. But when we talk of evolving practice, you know, pharmacy has been evolving. To the glory of God, I've been practicing for over 30 years. And I've seen a lot of evolving, evolution in pharmacy practice. Because now, in those days, it used to be prescription center. But now, we are talking of, is it patient care or patient center? People in clinical practice, I believe you can help me now. It's patient care, patient center. It's not just to dispense, okay, take paracetamol, take this, no. And I believe as students, we have to move with the changes. We should not be stagnant. Because if you want to do well in this chosen profession, then you must be ready to move with the changes. And that is, you have to keep updating yourself. You cannot, don't say because you are finished from pharmacy school, oh, that's the end. No, that's the beginning. You have to study, go online, check things, which I still do. It's not because I was telling the chairman today that somebody wrote a prescription for my mom. I've never heard of it before. I have to go and Google it, check everything about the drug. Do you understand what I'm saying? So, and I believe with this symposium, all of us will be able to learn something new, and I will learn something new because I'm always ready to learn new things. And you know me in class, I always tell you, if there's something new that you know, tell me, nobody's above learning, nobody. So, but the thing is, I have to be honest with you, I'm not very happy with your turnout.
Thank you so much for honoring me to be here. I want to thank our Dean, our Lawrence that's what I know him with. I want to also thank or welcome all our other high table presenters, and I also want to welcome all of you and thank you for the opportunity to share today.
I think goosebumps at the back of my head. I think it's my brain trying to send a message. Dear Nigeria, finally I'm writing to you. Anytime I pick up my pen to write to you, I feel a rush of impulse to my brain. I see images of an hailstorm in form of a rain that has stormed our values, stormed our culture, and caused many to live in pain. Dear Nigeria, anytime I pick up my pen to write to you, I see images of a teenager drinking an insecticide just because he failed jam. He used sniper to make himself white, but what is the use of the dead now? Dear Nigeria, anytime I pick up my pen to write to you, I see images of collapsed buildings and children being pulled out from the debris. Nigeria, you have just become a game of Tetris. Dear Nigeria, I see images of the doctor jumping into his rivers of death just because he failed his medical board examinations. There's a way for become better doctor where everybody go in farms. A doctor that was supposed to save lives, but he couldn't save his own life. Dear Nigeria, the more I love you is the more I hate you. The more I like you is the more I despise you. Because I don't know where the real problem is. If it's from our gorillas in suits who calls themselves politicians, or from our teenagers or from the dying youth. Dear Nigeria, our writers predicted the stage. They said a time will come when things will fall apart. They said a time will come when we forget to smile when we see half of the yellow sun. They said a time will come when we forget to be happy when we see the purple hibiscus blossom. They said a time will come when our ladies will just be concerned about their face, but they forget that the beautiful ones are not yet born. They said a time will come when our ladies will be so confused like the women of Ogun. They said a time will come where our ladies will forget the joy of their motherhood. Dear Nigeria, we have musicians, sure. We have Nigerians that have got talent, but they have made their own project fail. They have become like Nigerian idols and they are just concerned about the ultimate search of wealth. What happened to the days of African China and Fela, who stand for the betterment of the country? Not the images I see now. No. I see youths jumping up and down like grasshoppers with local radios. And they give it names like Shaku or Sanku. Then Nigeria, you were supposed to be the giant of Africa, but this Goliath is dead. He was killed by a David who used 3 stones, poverty, corruption, and crime. Then Nigeria, I'm going to say the truth. I'm not going to sugarcoat. Nigeria, you are turned and not put like a 100 naira note. Then Nigeria, what happened to the days where we were celebrating harvest with the farm men? We didn't need to worry about the bomb men or the Fulani men. It's funny how we go to a malam with 360 naira and go with $1. Then Nigeria, I'm going to end by saying this. You are Nigeria, I am Nigeria. Why? We spell Nigeria wrongly. Spell Nigeria 7-letter word, Nigeria. That's not the spelling of Nigeria. Nigeria is just 2 letters of the alphabet. Even Alpha can bet that Nigeria is just you and I.
Pharmacist Ayelabola Lawrence.
Your post?
I'm the chairman, Pharmaceutical Association of Nigeria, Ogun State.
Wow, we are very honored to have you here today, sir. Sir, you talked at the symposium about adapting to evolving practice in today's pharmacy profession. What advice, what tips can you give to us, the students, trying to get into the real life of pharmacy profession? What advice do you have for us?
My advice is simple. As pharmacists, as pharmacy students, you should have an open mind to learn. You should have an open mind to be the best where you are. So really, because when we talk about adapting to evolving trend, things will keep changing. This 2019, in the next 10 years, the face of the practice will be different. So just have an open mind and be ready to adapt.
Okay, thank you, sir. We also noted that you said you graduated from this same school. Is that true, sir?
Yeah, like two decades back, I graduated from Olabisi Onabanjo University School of Pharmacy.
Wow, that is awesome, sir. Can you comment on the changes so far?
When I got here, I found it very hard to locate Faculty of Pharmacy. So much changes, and that's what we are saying. Evolving. Look at the program of today. During our time, we never had it. Look at the training of building self-confidence that they had. And that's all about being successful in life. You need to change, environment will change, you change with the environment, and you are good to go.
Okay, sir, do you have anything else you want to add for us? Any nugget of advice for those of us who want to get to where you are today?
What I say most times is that the future belongs to the people who go after it. The future is not going to come to you. What you want is not going to come to you. You have to go out after it. You love something, go after it. And that's just it.
Thank you very much, sir. We're really grateful to have you, and we're thankful that you gave us some time. Thank you very much, sir.
You're welcome.
My name is Dr. U.I.E EZE. I am a lecturer at Olabisi Onabanjo University, Shagamu campus. I lecture clinical pharmacy.
Okay, ma, we are grateful to have you here and that you made out some time to talk to us today. So, ma, during the Pharmacosymposium, you talked about building self-confidence, and as we could see from your citation, you have so many accolades: M.Pharm, D.Pharm, PhD, so many awards. Ma, we just want you to share a bit with us about your journey to self-confidence.
Okay. Actually, I think it starts with knowing God and then allowing Him to direct my path daily. Because when you wake up with Him, He will see you through. And then He helped me to do good, to prepare for everything that I need to do. And then hard work, patience and honesty, I'm sure. And then the confidence that was also built in me by my parents and the people around me. I think that's principally all. And then having to increase my competence all the time. Having to believe that I don't know it all yet, that I have to continue to learn until I get there.
Okay, thank you very much, ma. And ma, also you talked about dressing nicely, and as we can see, you are dressed very nicely, ma. So what tip do you have for ladies? I mean, we are told to dress corporate, they're told to dress corporate, so what tip, little nudges can you give us?
Keep it simple. Keep it simple and then know what suits you, what you look good on. Try on so many things. Try on hairdos and know the one that specifically fits your face. And whenever you wear them, you will look good, surely. And then, of course, wear rhyming clothes, rhyming colors, and all that.
Okay, thank you very much, ma. One more thing, any advice for us generally as people aspiring to be where you are today?
My general advice is that we should keep learning and trust God.
Thank you very much, ma. We're so grateful you made out time for us.
I'm Chikelu Evans, popularly known as Chiboy. I'm a student of this faculty, a pharmacy student actually.
Okay, while the symposium was going on, you were opportuned to give a presentation on Nigeria, a poem, a sort of poem, what could you say inspired you?
What actually inspired me is the situation of the country. You know, when I switch on the TV every day, I see things upon things that drives me crazy, that makes me angry and frustrated. So one day I just decided to write a letter to Nigeria himself. I imagined looking at Nigeria and writing a letter to her. So that's it.
Wow, that is really creative. And I mean, as a pharmacy student, it is so nice that you're mixing two things together, as the other speakers have said. I mean, what advice can you give to your mates who want to mix pharmacy and their dream or talent?
Okay, the only thing I can tell them is that book is not everything. It's not about books. Some of us make our life dependent on books only, but I believe there are more to life than books. That's all I can say.
So you're not saying school na scam?
It's not really a scam, but it's a partial scam.
Okay, thank you very much for talking to us.
My name is Samuel Olabisi. I'm the president of all the pharmacy students in Olabisi Onabanjo University, called PSN OOU. So I'm PSN OOU president, and I'm currently in my penultimate year in pharmacy school. I'm in 400 level studying pharmacy.
Okay, thank you very much. Now, as the past president, you were the main driving force behind this Pharmacosymposium. Could you maybe just share with us what your inspiration was regarding the theme, adapting to evolving trends in pharmacy?
Well, let me just start from the, being the main force, like you said earlier. Well, it's a collective effort because this is our tenure. Basically, we work in line with synergism, coming together. So it's not really by virtue of the, the reputation or personality of the president. So we're in line with the theme, adapting to the evolving practice in this our dynamic society. It's by, we are basically inclined to building a 360-degree student pharmacist, a set of pharmacy students that will be able to think beyond the box, people that will be able to think beyond making 5.0 CGPA all the time. So basically we are trying to have a 360-degree student pharmacist that will be able to impact tremendously in this our changing and evolving healthcare system. Just like now in pharmacy, we are the pharmacists out there, they are patient oriented right now. So our attention is much more driven at patient, not producing drugs alone. We center our orientation towards patients again. So that's the reason why we need also the student pharmacists, because in the nearest, in few months, like those in 500 level, and few years, like those in 2, 3, and 4, they will be the one doing justice to healthcare. So we need to build active thinkers. That is the motive behind the
Okay, well, thank you very much for that. We also want to ask you another question, which is, well, definitely I can see that you are very dapper and fashion oriented. So apart from being the past president, what else are you doing with pharmacy?
Looking at me, my life, I'm a whole drama on my own. Well, aside from pharmacy, I act. I'm an actor. I do a lot of stage drama for RCF, Redeemed Christian Fellowship OOU, and I was once the former drama court. And aside from that, I think I sing also, not love songs though. I rap also. I do some fun. Aside from reading, aside from pharmacy. When you take pharmacy outside of Samuel Hour, you see drama, you see a musician, you see I'm sociable, you see a social person. So
okay, thank you very much. And one last question, what advice can you give to anybody aspiring to be in your position?
If you are, to those aspiring to, to take the lead when I leave the position, they really need to set their goals first, because being the PANS president and trying to strike a balance between academics and PANS, it's a whole lot of stress. So you have to first devise what you want to achieve from the tenure. And also you ensure that you must be strong enough to be a PANS president, because in terms of sourcing for fund, it's actually a great problem. So you have to be able to be ready to face the problem, and then at the end of the day, you know that you are not just a pharmacy student. You are beyond being a normal pharmacy student. You've gone through, you know, the myriad of fire, just like what Diamond must have gone through before it shines. So that is it. So my advice basically is just for them to, you know, let them, you know, devise their plans for the association and should be able to, you know what, impact tremendously in their own lives.
Okay, well, thank you very much.
Oluwayemisi for me. I'm founder level pharmacy student and the vice president of Pharmaceutical Association of Nigeria students OOU.
Okay, it has come to our notice that you are the first male vice president. How did you achieve this?
Yeah, actually that was not my motive when I was going for the post. I just wanted to become the vice president. So it all came in the middle of everything, and then I was determined, even though it was very, very tough, and then I just played my game well and it all came by.
Oh, that is very nice. So what do you have? What motives have you had? What have you done to impact the pharmacy students?
All right, you know, as a vice president, you really do not have a lot to do. All you just have to do is to keep supporting the president. So I think I've given all I can to the association and then to PANS OOU at large. So I have worked with my president with all effort, and it has all been going on well.
Okay, so do you think the Pharmacosymposium that you organized, that the team organized, actually achieved what you expected it to?
Yeah, definitely, because I must actually say this, because the turnout over the years, and when you organize programs like this in pharmacy school, are not always encouraging, but seeing something different today really gave me a peace of mind. And from what the speakers have said and the few other things we did, I believe we have achieved, if not 100%, at least to a large extent what we intend to achieve.
Okay, thank you very much for giving us some of your time. We're very happy. Thank you. On behalf of the students of the Faculty of Pharmacy OOU, I can definitely say this Pharmacosymposium was one that impacted us greatly. From Remo TV, here, reporting live, we had a really nice time.